What we're going to do over the next short while is we're going to have a look at some definitions, background and context to human factors. We're going to talk about various types of errors, selected examples in lifeguarding, some practical antidotes that you can hopefully apply, and finish with a summary and some recommendations. So, what on earth do we mean by this term human factors? Well, there's a couple of nice definitions. This one I'll allow you to read. But I'll show you an alternative definition that I quite like in preference to that one, which tells us that human factors are systems, behaviours or actions that modify human performance. They can be attributed to the individual, a team of individuals, or the way these individuals interact with the working environment. And I like that one from a lifeguarding point of view because some lifeguard services operate in teams, other lifeguard services have sole lifeguards at a pool or in a lifeguard tower. Now, human factors operate on two levels. The first level is how humans work in a system or an environment, and that goes into ergonomics, which in itself is an entirely separate division of science. But what we're most concerned about here is the second level on which human factors operate, and these are the non-technical skills. And we're going to cover many of what you can see on the list there in this presentation. An important point to take away at this point is that these two levels relate closely when it comes to errors. So the non-technical skills and how humans work within a specified system or environment, including the equipment that they use. So what do we mean by this term human error? Well, this is probably the most simple definition that we'll give you today. It's the failure of a planned action to achieve the desired outcome. And we define errors further as skill-based, rule-based, or knowledge-based. And we'll talk a little bit more about violations and also sabotage, which strictly speaking isn't an error. So if you look at the error rate, you'll notice that it's a lot lower for the skill-based errors. These are things that we do more commonly. And as we start having to use a bit more grey matter, a bit more brain power, you'll see that the frequency, that error rate, increases. Now when we talk about violations, let me give you an example of a routine violation. I'm a lifeguard on duty and I'm told that I'm supposed to run the IRB engine in the test tank for a full 5 minutes prior to taking it down to the beach. Does anybody run the outboard for the full 5 minutes? No, they don't. That's an example there of a routine violation. Everybody does it. Now, what about an exceptional violation? Let's say, for example, that I'm on duty. There isn't a qualified IRB driver. I've had a bit of experience. I don't hold my qualification. I'm not supposed to go out in the IRB and drive it, but because there's a person drowning, I'm going to do it. And that would be an example there of an exceptional violation. The last one that I haven't listed is sabotage. And we don't classify that as an error because if I succeed in my nefarious desire to sabotage a particular outcome, well, if I achieve it, then I have achieved the desired outcome. So we don't include sabotage as an error as such. So let's move on to have a look at slips, lapses and mistakes. So we define a slip as an unplanned action. And the example I've given you there is I've pressed the wrong button on a handheld radio. I wanted to transmit a message. Instead of hitting the transmit button, I hit the squelch button by mistake. We call that a slip. What about a lapse? Not completing a planned action. So again, I'm in the boat shed, I'm checking the IRB before I take it down to the beach, but I forget to attach the safety strop to the outboard motor. What that means is that if I'm out in the surf driving the boat and I flip it, then the motor can fall to the bottom of the ocean. And certainly in the UK, they have inversion protection on their motors, which means that if I get to right the boat, then I can start it again and continue on driving. So that's an example there of a lapse. As we go higher up the chain, we get into mistakes. And there's two types of mistakes that can occur. We do an action incorrectly. So an example there is I'm responding to a person in distress out in the surf, and there's multiple victims, and I rescue the wrong person. That's doing an action incorrectly. The second mistake is applying knowledge incorrectly. So I go down to the water's edge and I perform a preventative action on an individual when in fact a rescue was required. What we want you to take away from this is that slips typically occur at the task execution stage, lapses at the storage or the memory stage, and mistakes at the planning stage. So the more thought process that's involved, the more likely that a mistake is going to occur. Many of you, I'm sure, will be familiar with James Reason's Swiss cheese model of accident causation. And what we see depicted here is the slices of cheese represent the barriers and defences. The holes signify active failures, so that's what we were talking about a few moments ago, slips, lapses and mistakes. It's a bit of a tongue twister. But we can also have latent conditions within the system. So let's say, for an example, there's a manufacturing defect in an outboard motor. And in fact, we had this in New Zealand with our outboard motors across the entire fleet, that if you lifted up the tiller arm, turned the throttle and re-engaged the tiller arm, the cogs didn't match properly and you were unable to access full throttle. And when you're trying to race away from a big wave, you need full throttle. So that was an example there of a latent condition that was in the system. So the idea behind this, of course, is that we try and strengthen these barriers. So that's enough talk. Let's have a look at a critical incident, and I've got a question for you once we've watched the video clip.
Suddenly they see a woman waiting for help, having run the length of the beach.
So what went wrong in that video? Did anyone see the caption where he said, "Where are we going?" Did anyone see him just do a U-turn there? So in that particular incident, they responded, but they didn't know where they were going. And based on what we talked about a few moments ago, we would want to probably class that as a lapse. But remember, these lapses and slips typically occur in what we call lower states of arousal. In this scenario here, we've had a call to someone in trouble on the north side of Lion Rock. It's a high arousal state. The front of the brain is shut down. So think of it as your CPU in the computer has just been slowed right down, all right? And in that situation there, it's very hard to make those sorts of decisions. So why would we want to incorporate human factors into lifeguarding training? Well, I think we've just seen a very good example of the reason why. The importance of human factors training has already been recognised in other high-stakes environments, most notably aviation, also the military, and more recently, not so long ago, in healthcare. But it allows us to plan and train for likely error scenarios. It also allows lifeguard agencies to strengthen, test or implement barriers, and it can improve team performance. And I've also mentioned morale there because I'm sure many of the lifeguards in the room would have been involved in an incident that went well, but conversely, when you're involved in an incident that doesn't go so well, that definitely has an effect on team morale. But here's the most important reason of all, and it's to reduce the risk of harm to lifeguards and the public. And if this was in healthcare, we would simply say that it was just about reducing harm to patients. But remember, there's a difference in lifeguarding, and that is that there's the added risk of harm to the lifeguard, which doesn't necessarily always occur or seldom would occur in a healthcare environment. So let's have a look at some of these human factors we need to be aware of. Fixation errors. Definition there is the persistent failure to revise a plan in the presence of readily available evidence suggesting that a revision is necessary. And there are three types of fixation errors. The first one is called this and only this. And basically we focus on only one eventuality and other alternatives are not taken into account. And we actively try and discount them to fit our initial plan. This and only this. The second fixation error is called anything but this. It's almost the opposite of this and only this. And what we're trying to do here is that we're searching for information to refute other possible causes that don't support our initial diagnosis or plan. And there's a failure to respond, generally, with serious consequences. The third type of fixation error is called everything is okay, and it's quite difficult to relate this one to a lifeguarding environment. But in a clinical environment, the anaesthetist is looking at the monitor and the oxygen saturations are at a critically low level, but the patient has quite good colour and they don't do anything about it. Or alternatively, the saturations are saying that they are in a normal value level and the patient is looking blue. So we basically dismiss that as a monitoring artefact. But I think the best way to apply this rule to lifeguarding is what's highlighted in bold there, and that is a failure to transition from routine to emergency mode. And I'm going to show you 3 clips which demonstrate those fixation errors. 2 which are basically from a comedy show, 1 that actually relates to lifeguarding. So let's have a look at this and only this. Anything but this. Okay, and finally, everything is okay. So there's actually an argument there for that being anything but this. In fact, up until a couple of days ago, I thought that fixation error was anything but this, because when you see him coming back and forth from the camera, he's sort of, he's questioning, he's seeing all the signs that that person is in trouble, but he's sort of saying, no, he's kicking, no, he's snorkeling. But the thing that switched my thinking on that was that right at the start of the clip, there's 2 other lifeguards who've gone racing off to a suspected drowning type incident, and he hasn't yet transitioned from that routine to that emergency mode of operation. What about groupthink? The practice of thinking or making decisions as a group, resulting typically in unchallenged, poor quality decision making. Let's give you an example from a lifeguarding scenario. Imagine, if you will, there are 5 lifeguards on duty patrolling a surf beach. 4 of them, A, B, C and D, are located up in the tower. 1 lifeguard, E, is down at the water's edge on flag duty. Lifeguard A observes a swimmer in distress and alerts lifeguards B, C and D. Lifeguard B says, no, they're okay. Lifeguards C and D agree. Lifeguard A accepts the team's appraisal of the situation. What happens next? Anyone? Lifeguard E radios the tower to say she's responding to a swimmer in distress. So, let's unpick that a little. because there's some other considerations. Lifeguard A is a new member who qualified last month, but Lifeguard B is a senior lifeguard with over 20 years' experience. Is Lifeguard A going to challenge Lifeguard B? Frequency gambling. In a debrief after the incident, Lifeguard B says they don't normally need rescuing from there. It isn't a very strong rip. In other words, over the years, that lifeguard has developed a heuristic, a rule of thumb, which says, well, normally people, they get out of trouble there. They don't need to be rescued, right? But in this instance, they did. And finally, something that's going to permeate all aspects of what we do is this thing known as confirmation bias, where we're always looking for things to favour and support our pre-existing beliefs or hypotheses while giving less consideration to the alternatives. This one, inattentional blindness, is of particular concern in a lifeguarding setting because it's not associated with any vision defects. It's basically a failure to recognise unexpected stimulus that's in plain sight. And the implications, well, they're pretty serious, aren't they? The ability to recognise a person drowning is a fundamental skill of lifeguards. And we know that lifeguards are exposed to a number of distractions in their environment. Just the other week, Surf Life Saving Queensland announced that they were enabling data capture on smartphones on the beach, which is great when you wear your researcher hat. But are those lifeguards only going to use their smartphones for data input, or are they going to be Snapchatting? Are they going to be on Facebook? And as we've talked about previously in this meeting, people's constructs, their stored knowledge banks around what drowning behaviour look like may be inaccurate. And we've said before, there are lifeguards on duty right now who simply do not know what drowning looks like. So let's have a look at the all-time classic change blindness experiment, and this is a real test this late in the day, but here we go.
Count how many times the players wearing white pass the ball.
What was the answer? How many people have seen that video before? Yeah. I'll just play the rest of the clip.
The correct answer is 16 passes. Did you spot the gorilla? For people who haven't seen or heard about a video like this before, about half is the gorilla. If you knew about the gorilla, you probably saw it. But did you notice the curtain changing color or the player on the black team leaving the game?
So, how are we going to cope with all these human factor errors? Well, the primary antidote is this maintaining situational awareness. And the definition there we can break down to very simply saying knowing what's going on, processing inputs and information, and thinking about what may come next. And these are the sorts of questions that team leaders need to ask themselves. Was their initial assessment of that situation correct? Is what we're doing have any effect? Is the situation getting better or worse? Are there any new problems that we haven't anticipated before? What can be expected to happen in the future? And what additional resources and help is still required? And if you're part of a team, these are some of the red flags that would tell us that we are potentially losing this situational awareness. And you can read most of those for yourself, but in terms of lack of leadership, I'll just draw your attention to the fact that often, especially in lifeguarding situations, there may be more than one leader. We can't have that. The team leader changes. We call that revolving door team leadership. Or we see the team leader engaged in a task. And all of those things in regards to the team leader represent a loss of situational awareness. So one of the things that we can do is to try and have a shared mental model. And this definition here is particularly wordy, but in simple terms it means that we're all on the same page. And the strategies to achieve that involve a briefing, establishing a leader, and recapping by the leader. And some of the tools that we have, and I'm sure many of you will be familiar with this one, is the ISBAR tool. In some hospitals we have the ISBAR acronym on every single telephone, and it's part of how health professionals communicate with each other. Who are you? What's your role? What's the situation? What's the background? Your assessment? And what's the response or the recommendation? Here's one for recapping. It's known as SNAPPY. S is to stop and gather the team's attention. N is notify the team of the situation. A is assess what's going on. P is plan, prioritise, and invite ideas. And the triggers for a recap can be any one of these. There's a phase of lower workload during a crisis. Believe it or not, there are lulls where the team leader and the team have time to plan and make decisions. You're not sure what to do next. Now, in a good team, the leader or team member isn't afraid to say this. And in fact, the way that we train health professionals these days is they're allowed to say no. No, I'm not happy putting in that IV line, but I'm happy to do chest compressions for you. So we call that the right to refuse. And there are a couple of other scenarios there or situations where it's a good idea to have a recap. Effective communication goes without saying, and you can read that for yourself, but in terms of the things that we're looking for, specifying the receiver, using direct communication, speaking unambiguously, closed-loop communication, and listening actively. Let me take you back to our scenario where we had the groupthink taking place, and it's fair to say that most people are not assertive when it comes to speaking up for fear of being wrong, looking silly, or appearing to be difficult. So they keep their opinions to themselves, especially, as we saw in the example, if they conflict with older, more experienced colleagues. So if we use what's called the PACER acronym, this is me on that patrol deck. P for probe. Do we need to go and check on that swimmer? Alert. The swimmer to the right of the flags appears to be in difficulty. We haven't sent anyone to check on them. Those two things we call hint and hope. No one's bought into that yet. Challenge. Tom, the swimmer to the right of the flags is struggling. We should go and check on them now. Do you want me to send Sarah with the rescue tube and get the IRB crew on standby? E, emergency. Rescue, rescue, rescue. Swimmer in distress 50 metres north of the right flag. You haven't bought into my hint and hope. And R, react. Sarah, can you respond with a rescue tube? Dave and Chris, prepare to launch the IRB. That's graded assertion. Other antidotes? Calling stop, stop, stop. Do you remember in the video clip when everybody shot off and they don't know where they were going? I was actually on duty that day and I was trying to find the patrol captain to say, don't let these guys go anywhere, all right? But he didn't have the opportunity to do that. So the first thing we should do in a crisis is call a stop before we deploy any resources. Declaring an emergency. And in lifeguarding, we typically say rescue, rescue, rescue. All right? In healthcare, we say to health professionals, this is cardiac arrest. They declare that. Everybody's on the same page. And finally, and this is more of an organisational culture one, flattening the hierarchy. So this is a situation within a team, and it's supported actively by the team leader, where any lifeguard with any level of experience can voice a concern and they receive an appropriate response. They're not just dismissed. Cognitive aids. This is what medical and nursing staff in the hospital system in New Zealand and Australia are expected to have in their hand during a cardiac arrest. They can tick it, they can circle it, they're expected to refer to it in an emergency, not to make up drug doses and the like. And in fact, this is the Sentinel table that Billy Doyle and I developed. Just very quickly, it's not all that useful as a cognitive aid, but it says in simple terms, if you see this, early distress, do this, go ahead and do a rescue. If the patient presents with this, then do that. And there's no reason why we can't use these tools in lifeguarding as well. So, what can we take away from this presentation? Other professions that we've talked about have realised that just because you're a technical expert doesn't guarantee a good outcome following a crisis. And this is why health professionals train on advanced mannequins. It's why pilots go into the flight simulator. In lifeguarding, we need to do the same. Our current model of crisis management relies far too heavily on the presence of senior lifeguards being available on the day. What if there are no senior lifeguards with that level of experience? The skill set of team leaders and human factors is often incomplete. How many of our patrol captains are actually trained in crisis management and to use any of the antidotes that we've talked about with you this evening? Simulation-based training is something that we should be doing. There are some challenges to implementing it in the aquatic environment, but that shouldn't be a barrier to implementation. And there's a whole variety of levels that we can use, and we need to get past the fact that written literature and static images are the way to go. They're not. We need to use video clips. We need computer-based simulation. And I guess where this is all heading is that human factors is far too important not to be incorporated into all levels of lifeguard training. We can't eliminate human error altogether, but we can certainly take steps to reduce it and to teach our lifeguards a select range of antidotes which will give them a better chance than what they would have had previously. So, in closing, ladies and gentlemen, I'd like to leave you with this clip and ask you to consider what role human factors could have played in averting this non-fatal drowning. And certainly more discussion is needed to see whether or not we can improve the outcomes for patients and the safety of lifeguards during critical incidents like these.
I got a couple of people, two people at the back, and it stays on my neck and not healthy managers. A good sign. But no, I wouldn't be surprised to see that stick boat out and maybe get pick them up or it's always happening. They sort of sing well, they get the legs out of the boat. Yeah, I think it's just shut out. Three at the back, and there's four side closer in the lot. It's the guy at the back has a push on the sandbar there, and then it's lost the footing and pulled out. But I don't know, it's too bad. I think it could be, there's a good chance it could get washed in, but it's a bit easy to see from that. So what happens. So look at this shit like.
Two swimmers are swept off their feet south of the flags.
Hey, Dan, you only get the eyes on two boys at the back, hands went up, they're looking like they're in a bit of trouble. Yeah, hang up, Dan, go.
Being aided to shore, one swimmer, Sam, is in a bad state.
So, ladies and gentlemen, in closing, I'd just like to acknowledge the lifeguards in those video clips, because for most of us, we don't have video cameras depicting our day-to-day work, and human error is one of those things that's going to happen anywhere at any time, but it's incredibly valuable that those lifeguards have allowed us to use those clips to further our learning.